Good morning to all the distinguished personalities who have taken out time from their busy schedule to grace this event by their presence. I, Neha Jaiswal, lecturer, School of Pharmaceutical Sciences, Integral University, blessed to have the opportunity to welcome each and every one of you to this event. World Antimicrobial Awareness Week 2021, which is observed by Faculty of Pharmacy, Integral University, in collaboration with Interdisciplinary Biotechnology Unit, Aligarh Muslim University, Aligarh. Antimicrobial resistance is a complex problem affecting human, animals, plants, and environmental health. Addressing antimicrobial resistance requires a holistic and multi-sectoral approach. The WHO promotes the disseminating of related knowledge and ways to prevent and minimize resistance. A global action plan to tackle the growing problem of resistance to antibiotics and the other antimicrobial medicine was endorsed at 68th World Health Assembly in May 2015. One of the key objectives of the plan is to improve awareness and understanding of antimicrobial resistance through effective communication, education, and training. The WHO observes a week every year from November 18 to 24 to promote awareness of global antimicrobial resistance and to encourage best practices among the general public health workers and policymakers to avoid the further emergence and spread of antibiotic resistance. The staff members and students from Faculty of Pharmacy, in collaboration with Interdisciplinary Biotechnology Unit, Aligarh Muslim University, Aligarh, observes the World Antimicrobial Awareness Week every year in the month of November by visiting hospitals and rural areas to convey general awareness to physicians, health workers, patients, and general public about the importance and remedial measures to be taken to stop antimicrobial resistance. On this note, I would like to begin our inaugural session and request Professor Misbaul Hassan Sir, Dean, Faculty of Pharmacy, to give welcome address to the distinguished guests and the entire audience joined. Over to you, sir.
Thank you, Neha. I am Professor Syed Misbaul Hassan, and I am the Dean Faculty of Pharmacy. I am delighted to welcome you all to this webinar session on antimicrobial spread awareness, stop resistance. This is the theme of this webinar and the theme of this particular week of Antimicrobial Awareness Week.
Thank you, sir. It is indeed a pleasure to have Professor Javed Musarrat sir, Honorable Vice Chancellor, Integral University, and patron of the Professional Development Program with us. A professor of agriculture microbiology, he is an eminent academician, renowned scientist. Professor Musarrat is a seasoned professional in higher education administration. He has extensive international exposure and has served as visiting scientist at Michigan State University, USA. He has also served as Vice Chancellor at Baba Ghulam Shah Badshah University, Rajouri, Jammu and Kashmir, and held in various key positions and capacities at Aligarh Muslim University. I now invite Professor Javed Musarrat sir to deliver keynote address. Over to you, sir.
Thank you very much. Professor Syed Wasim Akhtar, founder and Honorable Chancellor of Integral University and Chief Patron of the program. Professor Syed Nadeem Akhtar, Honorable Pro-Chancellor, Integral University. Professor Aqil Ahmed, the Pro-Vice Chancellor. Professor Haris Siddiqui, Registrar of the University. Professor Syed Misbaul Hassan, Dean, Faculty of Pharmacy. Deans of the faculties, directors, head of the departments, faculty members, participants, and my dear students, ladies and gentlemen. First of all, I would like to congratulate the faculty and students of the Faculty of Pharmacy for organizing the World Antimicrobial Awareness Week in collaboration with Aligarh Muslim University, with a great purpose of promoting awareness about global antimicrobial resistance and to convey the message for restricting the indiscriminate use of antibiotics and its importance in controlling the emergence of antimicrobial resistance. And thus, the theme of today's seminar or webinar is spread awareness and stop resistance. It is heartening to know that the Faculty of Pharmacy has an extended plan spread over a week, encompassing several activities, including seminar on antibiotic resistance, visits to various hospitals and health centers, and also to perform street plays. Friends, we also have a very eminent professor of AMU, Professor Asadullah Khan, to deliver an expert talk on the subject. And I am so pleased to tell you that Professor Asad has been very closely associated with me for the last 29 years. And I always feel so proud of his scientific contributions and accomplishments. His lab at Aligarh Muslim University is actively involved in developing new inhibitors against multi-drug resistant clinical strains, including the infamous NDM1, which is the New Delhi metallobeta-lactamase 1, and CTXM. He was the first who reported Aligarh superbug NDM4, a variant of NDM1. He has published his research work in top-ranking journals and a recipient of several awards. So I'm so delighted to have him with us today. I do hope that the people from biology, pharmacy, and health sciences must be knowing about NDM1, which was first detected in Klebsiella pneumoniae isolate from a Swedish patient of Indian origin back in 2008. It was later detected in India, in Pakistan, Canada, Japan, Egypt, and other countries. In fact, NDM1 is an enzyme that makes bacteria resistant to a broad range of beta-lactam antibiotics, including the carbapenem family. Now, having said that, let me talk in a simpler way for the people like me to have a better understanding of what is antibiotic resistance. See, we all know that bacteria are present everywhere, in every living being, and in soil, in air, and water. So in simple terms, antibiotic resistance happens when the germs like bacteria and fungi develop the ability to defeat the drugs designed to kill them. That means the germs are not killed even by antibiotics, and they continue to grow. So the antibiotic resistance does not mean that the body is becoming resistant to antibiotic, but it is the bacteria that have become resistant to antibiotics designed to kill them. I will not divulge into the mechanism of antibiotic resistance, and therefore would like to prefer to remain confined to the theme of the program, that is the awareness part of it. Let me tell you that the first commercial antibiotic that was discovered way back in 1928 by Alexander Fleming was penicillin. And it was until 1942 and even later, it was considered to be a miracle drug, because prior to its discovery, that occurred due to very trivial injuries and diseases. And the first report of resistance to these antibiotics was noted in penicillin-resistant Staphylococcus aureus in 1942. And that perhaps has triggered the race for discovery of many more antibiotics like vancomycin, methicillin, azithromycin, imipenem, and ciprofloxacin and cefadexamine and many others. But how risky and dangerous is the antibiotic resistance? Threat report of 2019 revealed that each year at least 2.8 million people are infected with antibiotic resistant bacteria or fungi, and more than 35 people die as a result in United States. Similarly, the report released by the United Nations ad hoc interagency coordinator, at least 7 lakh people die each year due to the drug resistant diseases, including 230,000 people from multi-drug resistant tuberculosis. Therefore, antimicrobial resistance alone is killing more people than the cancer and road traffic accidents combined together. Now, it has been predicted that the drug resistant diseases could cause 10 million deaths each year by 2050 and could damage the economy tremendously. And by 2030, antimicrobial resistance could force up to 24 million people to go into extreme poverty. Now, that's the report says. Now, more and more common diseases, including respiratory tract infections, sexually transmitted infections, urinary tract infections, are almost untreatable. Life-saving medical procedures are becoming more riskier. Our food system are increasingly precarious. Around 214,000 newborns are estimated to die every year from blood infection called sepsis caused by resistant bacteria, and representing at least 30% of all sepsis death in newborns. Now that sounds really frightening, isn't it? The published report says that antibiotic resistance spread silently across the world. Now, more than 60% of the population in some areas carry multi-drug resistant bacteria in their normal bacterial flora. Now, what about Indian scenario with respect to antibiotic resistance? So, friends, way back in 2010, India was declared as the world's largest consumer of antibiotics for human health, and therefore some of the highest antibiotic resistance rates among bacteria that commonly cause infections in community and healthcare facilities are recorded in the country. Now, if you see the data from Council of Medical Research, AMR Surveillance Network, that it reveals that the resistance to broad-spectrum antibiotic fluoroquinolones and third-generation cephalosporin has been more than 70% in Acetobacter baumannii, E. coli, Klebsiella pneumoniae, and more than 50% in Pseudomonas aeruginosa. And also the proportion of resistance to carbapenem class of antibiotics and colistin, which are considered to be the last resort agents, was very high among these 4 gram-negative. Of antibiotics is one of the last resort antibiotic to treat. Now, what are the factors that lead to the development of antibiotic resistance? Some of the factors I would like to share with you is the indiscriminate use of antibiotics or antibiotic fixed dose combinations. Well, antibiotic fixed dose combinations are the combinations of 2 or more active antibiotics in a single dose form, and they are heavily prescribed even without the knowledge of a proven advantage over single compound. Now, approximately 118 such antibiotic FDCs are available in India, and the injudicious use of these antibiotic FDCs could lead to emergence of bacterial stains, resistant to multiple antibiotics. The social factors, such as self-medication, which the Dean has also pointed out, access to antibiotics without prescription, use of pharmacies and informal healthcare providers as source of healthcare, and lack of knowledge about when to use antibiotics also contributes substantially for multiple antibiotic resistance. Then antibiotic consumption in animals. It is estimated that India is the fifth largest consumer of antibiotics in food animals, including poultry or pigs and cattle. And a substantial portion of it eventually goes to environment. And I tell you that bacteria are present everywhere, including every living organism in soil, water, and air. So it ultimately ends up in developing the antibiotic resistant microbes. Similarly, non-therapeutic use of antimicrobial agents in the veterinary and fishery sectors also have a profound effect on emergence of resistance in microorganisms and their spread to human beings through food chain. Another factor could be through the pharmaceutical industry, which is causing a lot of pollution. The Indian pharmaceutical industry supplies 20% of the generic drugs worth billions of US dollars. An estimated 80% of antibiotics sold by multinational pharmaceutical companies on the global market are manufactured in India. And interestingly, the effluents from the antibiotic manufacturing units contain substantial amount of antibiotics, leading to contamination of rivers and lakes in India. In fact, the existing good manufacturing practices, what is called as GMP framework, is restricted to the extent of drug safety and does not include environmental safeguards. Friends, it is important for all of us to understand that the antibiotic selections of resistance and therefore poor sanitation also plays a significant role in the spread of antibiotic resistant bacteria. And more than 50% of the Indian population does not have access to sanitation facilities for safe disposal of human waste. And this is the World Bank report. In addition, a large proportion of sewage is disposed untreated into receiving bodies, water bodies, leading to gross contamination of rivers. Besides, a report published in British Medical Journal, which is a publication of British Medical Association, suggested that the unregulated sale of antibiotics, the financial incentives for healthcare providers to prescribe antibiotics, patients' expectations, rising incomes, and limited public health response have helped drive the emergence of antibacterial resistance. Indeed, over-the-counter access to antibiotics is a big problem, and almost all antibiotics are easily available over the counter in the country, leading to their rampant use. Therefore, to prevent over-the-counter sale of important antibiotics, the Central Drug Standard Control Organization, CDSCO, implemented Schedule H1 in India way back in 2014. The H1 list includes 24 antibiotics, such as the third and fourth generation cephalosporins, carbapenems, anti-tuberculosis drugs, and newer fluoroquinolones. But in a country of 1.5 billion people, the regulations to restrict access for the significant proportion of the population that lack access to doctors has to be balanced. And therefore, because of lack of access to the effective and affordable antibiotics, still kill more children in India than does the drug resistance. So with all these concerns in mind, India has taken cognizance of this acute problem. There was a Jaipur Declaration on antimicrobial resistance on 6th of September 2011, and then subsequently the Chennai Declaration in 2012 to formulate a national policy to control the rising trend of antimicrobial resistance and to adopt a holistic and multidisciplinary approach towards prevention and containment of antimicrobial resistance to improve public health. As a matter of fact, AMR is not a problem that can be solved by any one country or even any one region. We live in a connected world where people, animal, food, and microbes, they travel all across the globe. Therefore, global action is essential to make a meaningful progress over the long term. So what needs to be done? Essentially, what needs to be done is that a massive global public awareness campaign to be launched. We need to improve global awareness of AMR across the board so that the patients, the farmers, the general public do not demand, and clinicians and the veterinarians do not prescribe antibiotics when they are. Similarly, we have to work on to improve hygiene and prevent the spread of infection. So improving hygiene and sanitation was essential in 19th century to counter infectious diseases. And 2 centuries later, this is still true and is also crucial to reduce the rise in drug resistance. The less people get infected, the less they need to use medicines such as antibiotics, and the less drug resistance arises. So we have to reduce unnecessary use of antimicrobials in agriculture and their dissemination into the environment. There are circumstances where antibiotics are required in agriculture and aquaculture to maintain animal welfare and food security. However, much of their global use is not for treating sick animals, but rather to prevent infections or simply to promote the growth. The quality of antibiotics used in livestock is vast. It needs to be controlled through awareness. Animals is important. Surveillance is one of these cornerstone of infectious diseases and management, yet has until recently been often ignored and remains under-resourced in the fight against AMR. Now, to promote new rapid diagnostics to cut unnecessary use of antibiotics is also important, and therefore we should think of promoting the development and use of vaccines and other alternatives. Now, vaccine can prevent infections and therefore lower the demand of therapeutic treatments. It may reduce the use of antimicrobials and even slow down the rise of drugs. So besides other alternative approaches to both preventing and treating bacterial infections should be researched and to obtain alternatives to antibiotics and antimicrobial agents in future. So at the end, I appreciate the efforts of the conveners, Professor Syed Misbahul Hasan and Dr. Tariq Mahmood Ansari, and their entire team for organizing this Antimicrobial Awareness Week. I wish them all success in their endeavors to propagate the message for awareness about the restricted use of antibiotics and other antimicrobial agents to make this world a safe and healthy place to live in. I wish you all the best. Thank you very much.
Thank you, sir. It gives me an immense pleasure to introduce Professor Asad U. Khan, sir. Professor Asad U. Khan has graduated in chemistry and did his postgraduate in biotechnology and obtained a doctorate in biochemistry from Aligarh Muslim University and later proceeded for his postdoc in Rutgers University, New Jersey, USA during 2000 and 2003. Currently, he is professor and ex-coordinator Biotechnology Unit, Aligarh Muslim University. He has a rich experience of 23 years in academics and research. He has published over 240 research and review articles in internationally reputed journals of high impact factor and having more than 3,200 citations with H index 44. He is recipient of National Bioscience Award for Career Development of Government of India DBT in 2012, Young Scientist Award and Alembic Award of Association of Microbiologists of India in Medical Microbiology in 2006 and 2009 respectively. He is recipient of Visitor Award of President of India in 2019, Om Prakash Bhasin Award of 2019, and Malviya Memorial Award of BRSI 2020. He is appointed as expert member of steering committee of UK Academy of Medical Science and Hamid Foundation UK India AMR program. He has been recognized as eminent researcher in his field of antimicrobial resistance by Government of India and Research Council UK. I invite Professor Asad U. Khan sir